We are taking charge of every facet of our lives, and this is Take Charge with Sophie. My name is Sophie. For the past few weeks, we've been talking about infertility, what the misconceptions are, the causes are, the treatment options, and many other things that um, have been discussed over the weeks. In this episode, we'll be talking about management of pregnancy and also talk about biblical assurances of childbirth. So why am I talking about management of pregnancy? So a lot of women, it's not that they don't conceive, they're able to conceive all right, but if the pregnancy is not being managed well, they end up not coming home with their children, and then the whole idea of childbirth will not be achieved. So I will be talking about the preconception care, antenatal care, and care during intrapartum and postpartum care. So it's very, very, very important. If you are pregnant, there are certain things that are expected of you. So for the pre-pregnancy care, this is the care that is given to a woman who is trying to conceive in the future. The purpose of a pre-conception care is to find out if the woman has any conditions that could potentially affect the outcome of any future pregnancy. So lifestyle issues such as smoking, alcohol intake, or abuse of substance or cocaine or marijuana will be addressed. And then there are also issues about weight management, and if there are certain medical conditions too, they will also be discussed. And if so around this time, the woman may be given folic acid for the person to be taking daily in preparation towards the pregnancy. Then the antenatal care is care during pregnancy. Pregnancy is very delicate, so at every stage of in a pregnant woman's life, special care needs to be given. So antenatal care refers to the education and medical supervision that is given to a pregnant woman from the beginning till labor. So antenatal care is very, very important because anything that goes wrong will mean that you have not achieved your aim of having a child. So with antenatal care, a woman is expected to go to the hospital. In Ghana here, you are expected to visit the hospital from the beginning of your pregnancy, some every month. And then once your pregnancy is progressing, you can go 2 weeks, especially to the end of your time. And during care during pregnancy, it's very important that the woman takes very good care of their diet and then their nutrition and then exercise during pregnancy. Diet is very important. If you eat healthy, your child will also benefit from it, and then that will help you. And the woman is also expected to rest a lot during pregnancy. Pregnancy may also come with complications and dangers, so it needs to be professionally managed. So prevention of infectious diseases like malaria is not good for a pregnant woman. And then HIV too. If the woman has HIV, it needs a special care. And then birth preparedness, labor delivery, and all those things that are actually tackled during pregnancy. So during pregnancy, certain laboratory investigations need to be done to check the woman's blood level, the blood group, the sickling levels, and all those other things, HIV, hepatitis, and any other thing that could affect the baby. So if you are pregnant and you're fortunate to be pregnant, you have to protect that child by going to the hospital, doing all the prescribed laboratory tests that have been requested by the doctors. You cooperate with them to help you through the period so that you can have your child. There are medical interventions during pregnancy. That's provision of folic acid. They'll give you folic acid for you to take, and then some other tetanus prophylaxis will be given to you and all that. There are some women who say that as for them, they have never their mothers were pregnant and they never visited the hospital till they gave birth to them. So as for them, they are not going to do that. Times have changed, diet has changed, and everything. So you cannot do what was happening in our great grandmother's time and expect a good result. So if you are pregnant, work with the medical people hand in hand so that they will be able to deliver you safely and that of your baby. One other important decision that people are supposed to take during pregnancy management is the decision whether they will deliver SVD, that's spontaneous vaginal delivery, or Ghana here, they call it natural birth, and then a cesarean section. Some people actually pray against cesarean section, thinking that giving birth through a cesarean section is not like a Hebrew woman kind of thing. See, what is important is that your child actually comes out. It's not about doing superhero things and at the end of the day killing yourself. So some babies are delivered through the vagina if all the parameters are okay. If the baby's head is positioned well for delivery safely, if the baby's weight is okay, and if there are no other problems, the doctors may recommend that you give birth through the vagina. But if maybe there's a breach, the baby's legs are rather or coming down, and then the weight is heavier, and then maybe the umbilical cord is tied around the neck of the child and all other conditions, the doctor might recommend that you do a CS. And a lot of people have refused to do CS and have ended up dying together with their babies. So especially the superhero Christian women, God has given wisdom to the doctors to decide what will help us. When you pray a miracle happen and you give birth before getting to the hospital, fine. But if a doctor recommends strongly that you should undergo a cesarean section to deliver you safely and your baby, you have to go through it. A mother is a mother. It doesn't matter whether it was CS or an SVD. I have had 2 of my children the vaginal delivery, and then the last one I had was CS. And I think that even the CS is way more painful. Post CS, you go through a lot of pain, and the healing is not as fast as you can think. So a mother is a mother. You carried your child 9 months. It's not the few minutes that the baby is brought out that will determine whether you are a mother or not. So if it is recommended that you undergo CS, undergo it and deliver your baby safely. And the next thing I want us to talk about is biblical assurances of childbirth. I'm a Christian. I believe that God exists and God intervenes in the affairs of men. In the Bible, there are people who have gone through infertility and they've thought as if like it's never going to end, but God actually intervened in their situation and actually came through for them. So we have Rachel who gave birth to Joseph and Benjamin. Elizabeth also gave birth to John the Baptist. Samson's mother was also an infertile woman, but after prayers, God actually intervened. And if you read Exodus chapter 23, verse 26, it says, "There shall be no barren, and no one shall cast their young before time." So miscarriages and all that. So you have to claim the biblical promises to yourself that God says that none shall be barren amongst us. You have to claim it, and then you have to use faith, because the Bible says that it is faith that helps us receive from God. So whilst praying, we should reduce our anxiety and all that. You cannot be anxious and receive a miracle. The Bible says that we should be careful for nothing, but in all things with prayer and supplication and thanksgiving, we should make our request known to God. So if you are praying, you shouldn't be anxious. Just be thanking God and trusting that He will do it. And sometimes, even after doing everything, if it's still not coming, still stay true to your God. Be close to Him. In His own time, you make all things beautiful. For all you know, the delay may be for a reason, and God's own sovereignty. Sometimes you cannot question Him. Now, let me ask, are childless couple not blessed? Children are a blessing. Not having them, however, does not make one unblessed, because there are other blessings in life, such as health, good job, riches, peaceful life, and all that. One's inability not to have children does not mean that other blessings in life should be ignored or overlooked. God's blessing on a couple in terms of childbirth has been there from creation, but there are some obstacles that prevent it from coming. If you continue trusting in God, in His own time, He will make it happen. Some people believe that childlessness might be hereditary. So scientifically, some women are unable to conceive and deliver baby due to genetic factors. This can be due to inherited chromosomal abnormalities and all that. All this, there's nothing too hard for God. Continue in prayer and trusting God. Like he did it for Rachel, he did it for Hannah, he did it for Elizabeth, he did it for Rebecca. He will do it for you. And Genesis chapter 8, verse 22 says, stress that as long as the earth endures, seed time and harvest time, cold and heat, summer and winter, day and night will never cease. So continue loving your spouse, showing him or her love, and trusting that God, in his own wisdom, will make your child available to you one day. Thank you so much for making time to watch this episode. God bless you. Like our video, comment, share, subscribe, and press the notification button so you can watch our videos anytime we post them. Thank you very much. There'll be a last episode on surrogacy and adoption. Please make time and watch it. Thank you.